Hello, everyone. Welcome to Therapy Clips with Dr. O. Today, our topic will be harmful interactions, mixing alcohol with medicines. So, the first thing I want you to know is that some medications that you may think never is a problem with alcohol could be a problem with alcohol. For example, certain over-the-counter medications and herbal remedies can be harmful when mixed with alcohol. Some of the allergy medications that you may take, for example, Benadryl, may also be harmful when mixed with alcohol. Did you know that mixing alcohol and medications can be harmful? Alcohol can make you sleepy, drowsy, and lightheaded. So can other medications. So when you combine the two, then it intensifies the effects. You may have trouble concentrating or performing certain types of skills. Small amounts of alcohol make it dangerous to drive or to use certain types of machinery. Combining alcohol with medications can lead to falls, serious injuries, especially among older people. Did you know that medications have many ingredients, and some of these medications contain alcohol? Some medications, including many popular painkillers, cough and cold, and allergy remedies, contain more than one ingredient that can interact with alcohol. So make sure that you talk to your pharmacist or doctor about certain medications not to drink with alcohol. Do you know that some of these medications contain alcohol? For example, cough syrups and laxatives. Now I want to talk to you about certain populations who are more likely to develop problems because of alcohol. So let's talk about how alcohol affects women differently than men. When a woman drinks, the alcohol in her bloodstream typically reach a higher level than a man's, even if they drink the same amount of liquor or beer or wine. This is because women's bodies generally have less water than men's bodies. Because alcohol mixes with body water, a given amount of alcohol is more concentrated in a woman's body than in a man's body. As a result, women are more susceptible to alcohol-related damage to the organs, such as the liver. Did you know that older people, like your elderly population, are at greater risk? Older people are particularly at high risk when they drink alcohol with their medication. Aging slows down the body's ability to break down alcohol, so alcohol remains in the older person's bloodstream longer. Older people are more likely to take medication that interact with alcohol. In fact, they often need to take more than one of these medications. And so they have to be especially careful and speak with their doctor about whether or not they can drink alcohol while taking particular medications. So remember, mixing alcohol and medicines puts you at risk for dangerous reactions. Protect yourself by avoiding alcohol if you're taking medication and don't know what the effects would be. To learn more about a medication, whether it is available to be taken and allowing you to be able to drink. Once again, talk to your pharmacist or your healthcare provider to learn more. So now we're going to talk about some of the medications that you have to be aware of and not to mix with alcohol. So we're going to talk about the categories, and then I'm going to name some of the medications. So the category that we're going to talk about is allergy, colds, and flu. medications. And some of these medications are things like Benadryl, Claritin D, Dimetapp, Sudafed, Trimenic, Tylenol allergy, sinus, Tylenol, cold and flu, Zyrtex. Okay? Now, the reaction that you're going to get if you mix any of these type of medications with alcohol is that it's going to be drowsiness, dizziness, and increased risk for overdose. Now, we're in the category of angina. Angina is when you have chest pains. One of the medication is called Isodril, and when mixed with alcohol, it can cause rapid heartbeat, sudden changes in blood pressure, dizziness, and fainting. Now we're going to talk about anxiety and epilepsy. Some of the common medications that you may have heard of is Ativan, Buspar, Klonopin, Librium, Paxil, Valium, Xanax, and certain herbal preparations like Kava. When mixed with alcohol, it can lead to dizziness, drowsiness, increased risk for overdose, slow or difficult breathing, impaired motor control, unusual behavior, memory problems, liver damage, and drowsiness. Our next category is arthritis. So you know that naproxen, Cerebrix, Voltaren are the brand name medications. Mixed with alcohol, it can cause ulcers, stomach bleeding, liver damage. Now we're talking about your medications for ADHD. And so that would be Adderall, Concerta, Ritalin, Dexedrine, Strattera. And when mixed with alcohol, drowsiness, dizziness, impaired concentration, heart problems, liver damage. Medications that's taken for blood clots. Ketamine. And now, the medication when mixed with alcohol can lead to internal bleeding. Heavier drinking can also lead to bleeding. Okay, so occasional drinking leads to internal bleeding, but heavier drinking can lead to bleeding that have blood clots associated with it, strokes, and heart attacks. Your cough medicines, like Robitussin, when mixed with alcohol, can lead to drowsiness, dizziness, and increased risk of overdose. I want to say that if you're in my group, I've given you a packet with this particular brochure in it. So please open your brochure and read through the brochure even though you're listening to this presentation, because there's other medications that I'm not mentioning in this presentation that's in the brochure. If you're not in my group, the title of the brochure is Harmful Interaction, Mixing Alcohol with Medication. And you can receive this brochure free of charge through the National Institute on Alcohol Abuse and Alcoholism. So let's go back to our presentation. Now, as far as depression goes, any medication that you're taking because of depression, like Abilify, Clozarine, Zymbalta, Advil, Lexapro, Paxil, Prozac, Risperdal, Seroquel, Wellbutrin, Zolox, Zyprexa, and an herbal preparation called St. John's wort, when mixed with alcohol, can cause drowsiness, dizziness, increased risk for overdose, increased feelings of depression or hopelessness, impaired control, increased alcohol effect, liver damage. If you're taking the monoamine oxidase inhibitors, which you know as MAOIs, when combined with alcohol, it can result in a serious heart-related side effect: high blood pressure, and when mixed with tyramine, a byproduct found in beer and wine, harmful effects can happen in the body. Now, let's talk about the diabetes category. A lot of people are on diabetes medication. And so, diabetes, glucotrol, glycinase, diabeta, macronese, oronese, Tylenol are some of the medications that's being taken by some people. And when mixed with alcohol, it can lead to low blood sugar, a flushing reaction such as nausea, vomiting, headache, rapid heartbeat, sudden changes in blood pressure. Symptoms of nausea and weakness may occur. So, especially when you're taking the diabetes medication, metformin. Now, for people who are taking enlarged prostate medication, like Flomax, Hytrin, Minipress, when mixed with alcohol, it can lead to dizziness, lightheadedness, and fainting. I'm sorry about that. Okay, so because I'm trying to read along as I look at some of these medications and these categories. We have several categories left. Okay, so let's talk about heartburn and indigestion. So when you're taking medication like Tagamet or Xantax, mixed with alcohol, it can lead to rapid heartbeat, increased alcohol effect, sudden changes in the blood pressure. When you're taking high blood pressure medication, such as Norvasc, Catapress, Calin, Acalprin, then when mixed with things like alcohol, it can lead to dizziness, faintness, drowsiness, heart problems. When you're taking high cholesterol high cholesterol medicine, not blood medicine, high cholesterol medicine, then we're looking at medications like Lipitor, Zocor, Avocor, Altacor, Crestor. When mixed with alcohol, then it can lead to liver damage, increased flushing and itching, increased stomach bleeding, especially if taken with aspirin too. Medications for infection, such as Flagyl, Nizarol, Narazen. Some of these medications are hard to pronounce. Tendramax, Zethromax. Then these medications, when mixed with alcohol, can lead to rapid heartbeat, sudden changes in blood pressure, stomach pain, upset stomach, vomiting, headache, or flushing, redness of the face, liver damage. Next category, mood stabilizers. And these are medications that's usually taken for depression or bipolar disorder, like Depakote, Depakine. When mixed with alcohol, then it can lead to drowsiness, dizziness, tremors, increased risk for side effects, restlessness, motor control that's impaired, loss of appetite, stomach upset, irregular bowel movement, joint muscle pain, depression, and liver damage. Now, this medication that you may take for muscle pain, like Fecturol and Soma, can lead to drowsiness, dizziness, seizures, increased risk for overdose, slow breathing or difficult breathing, impaired motor control, unusual behavior, and memory problems. Medication that's taken for nausea or motion sickness, Atavert, Dramamine, when taken with alcohol, can lead to dizziness, drowsiness, increased risk for overdose. Medication that you're taking for pain such as muscle ache, minor arthritis, fever, inflammation, such as Advil, Aleve, Excedrin, Motrin, Tylenol, when mixed with alcohol, can lead to stomach upset, bleeding and ulcers, liver damage, and rapid heartbeat. We have 2 more categories. Medications that you're taking for seizures, such as Dilaudid, Klonopin, Tegretol, when mixed with alcohol, can cause drowsiness, dizziness, increased risk of seizures, unusual behavior, changes in mental health. Severe pain from injury, medications. Or if you're having surgery or after surgery, if you have migraine headaches. These type of medications, Darvocet, Demerol, Percocet, Vicodin, when mixed with alcohol, drowsiness, dizziness, increased risk for overdose, slow or difficulty in breathing, impaired motor control, unusual behavior, memory problems. And our final category is sleep problem medication, such as Ambien, Lunesta, Somanex, Unisom, and some herbal medications such as chamomile or lavender, when mixed with alcohol, can lead to drowsiness, sleepiness, slow or difficult breathing, impaired motor control, unusual behavior, memory problems. So, that's what I want you to know. That you have to be extremely careful when you're taking medications and herbal remedies for certain type of ailments. You must be especially careful not to mix these medications with alcohol. We want you to live and we don't want you to overdose, because overdose can lead to coma or death. And we don't want neither for you, because if there's coma, it may be brain damage and you may not be able to recover from that. And of course, if you die, there's no recovery. So basically, I want you to be safe and to not take these different things into your body. And if you have an alcohol-related issue, then you definitely need to be careful about what you ingest as far as medications are concerned. This is Dr. O from Human Service Consultants, asking you to refer to your booklet. If you're in my group, you do have it. I gave it to you. Please look into it, because there's other medications I did not mention. And so all you need to know is what type of disorder you have or what type of illness you have, and then look for that category in the booklet and know the medications when mixed with alcohol can lead to certain things. So your medication could pretty much be on that list. And so with that being said, I'm going to say have a blessed day. Be safe. God loves you and so do I. Love someone else, but more so than that, love yourself. Take care.